Welcome back to Front Office Rocks and Practice by Numbers. We're digging into the data and loving it and having fun. And one of the things about Practice by Numbers is we have all of this data that we can track. We can track new patients, production, case acceptance. We can track all of this stuff in the office. But how do we know if we're doing a good job or not? How do we know if we're hitting the goal that we want to hit? How do we know how we're doing compared to our annual goal or what the doctor's trying to get to reach? So what we're going to talk about in this video is how to set goals in the practice. I have Rohit here, of course, from Practice by Numbers, who's going to show us how to do this. And there's really two different ways. There's kind of a fast overall way and then a very specific way. And we're going to show you both in this video. So Rohit, if you want to get started and show us what's the easiest way to put in a goal so that at least that way I can see how I'm doing compared to where I want to be or where I was last year.
Right. All right. Well, first of all, welcome everyone. And so let's jump straight into the goals. As Laura said, there's two main ways to set the goals. One is setting goals for all the KPIs on a page, right? In one fell swoop, you can set the goals on every single KPI on the page that you see. And for that, you have to go into the goals page. Okay? And then once I show you that, I'll come back into showing how do you set individual goals. So the way you set the overall goals, meaning goal for every single thing on the page, is you click on this little man and go into the goals section.
We need to name that little man.
Yeah.
Goals man or something.
Goals man.
Goals man.
We need a mascot for Practice by Numbers.
There we go.
So this brings you to the goals page, and it looks very similar to the page that you were on. All the pages that were operational, patient flow, clinical, and all that stuff is over here. So, and what this has done is you're setting goals of all the KPIs that were on that particular page. So for example, in home, I can come in here and I can set individual goals. And here's the difference to take a look at it. Here's a goal that you have a percentage. You can adjust the percentage, but this percentage stays the same for the whole year. So when you say, I want 90% of my patients to accept treatment, okay, that's what my goal is, then you leave that, and that goal is the same for the whole year, for every single month. Versus something like this, which is when you see individual numbers for the whole year, that means you're setting the goal for each month. Okay, so there's very clear distinction. Let me also show you something else. For example, down here, we're looking at production, right? And production, you're setting the goal for each month. Okay? So how do we set goals from this particular page? You can go in and you can click on any one of these. So let's click on production. And production is already set. You can click on each month and you can enter a number. Come the next month, you can enter a number. And that's one simple way of doing it. But we have made it even simpler. So what you can do is you can say, copy from last year's numbers. So if you click on KPI, what this will do is it will copy how you did last year for the same KPI.
Okay. So it's pulling the data from our practice management software of how we did on each one of these KPIs, and it's putting in that same number this way so that we know how we did last year and how we're comparing against it same time frame this year.
Right, exactly. And this gives you a baseline, right? So if you're scratching your head and saying, I don't know what my average daily was last year, I don't want to have to go and create one. This is an easy way for you to find out. Well, it was about $13,000.
So for offices that maybe haven't been tracking like mine proactively, this would be a good way. If we don't know and we're looking to get better in certain areas, we could at least start with where were we last year? Every office should be improving, hopefully. So this will at least tell us that we're at least on target from where we were last year or ahead of the target. But it will also alert us if we're behind the target from last year, which means then we're not even doing the same, we're doing worse, and we need to put some attention on that.
Right, right. So what you can do is you can set the overall goals from last year and then go and tweak individual goals.
Okay.
At the very least, we should be doing the same or better. Okay?
Yes.
At least the same.
Yes.
So let's go ahead and we're going to save this page.
And one of the things that I recommend if you listen to other videos, because as everybody knows, I'm implementing practice by numbers in my office currently, is I'm going to go ahead and set everything the same as last year. So I at least can see we're doing as well or better than last year. Then I'm going to go back into the statistics, the numbers that I care about, and then do what he's going to do now, where I'm really going to target on it. Because we can't work on every one of these KPIs. It's just too many KPIs. But we have, let's say, 10 that we're really going to focus on for the next 6 months. So those I want to go in and customize so that I know we're getting better in those areas.
Yes. And sometimes we cannot calculate all the numbers from last year. And like in this case, schedule utilization, which shows as there's no goal over here. So what we need to do is go put in and decide what the schedule utilization should be. And 90% is a pretty good number to aim for schedule utilization, that you want to be booked 90% of the time.
I was just about to ask you, what did schedule utilization mean? So there we go. We do want to be booked 90% of the time. Great.
Okay. All right, so this is pretty good. And we're going to hit save.
All right, so what that did is it put numbers for everything to at least what we've either put in ourselves or to get us at least at the same level for next, or that we were last year.
Okay, so now this is what it's showing. Based on the numbers that you put in, the target for May 2017 was 231, because that's what you must have done in last May 2016. Okay, and the target for new patients this month is 47, because that's what you did last year. So right now you guys are running 4 patients behind from new patient standpoint. And you're running about 6,000 behind in terms of production compared to last year.
This office then, based off of last year, is running behind, but maybe also we want to set different goals. Maybe our goal is to be a little bit ahead of where we were, where this office was last year. So then how would we customize that?
So you can come in right here. So you can do it on the other page that I showed you, but it's just so much easier to take a look at the number on what you're trying to do and make changes right on the main panel. So for that, click on this little small arrow, and there's always a set goal next to it. Okay. And in this case, I'm going to click set goal.
And if for some reason it doesn't work, I've noticed you hit the refresh button and then it works for you. So sometimes internet and recording doesn't always work correctly. There we go.
There we go. So now production, remember we copied everything from last year. So these are exactly last year's numbers. So if you see the last year and the goal is exactly the same. So there's 2 things you can do. You can come in, increase everything by a certain number, right? So you can say add 5% to every single month, or you can click on each and every month and you can add a new number. So I can click on each and every month and I can add a new number over here. And tab takes you to the next month. So if you hit tab, it'll take you to the next month.
Perfect.
So Laura, what should we add the goal as? Should we try to say increase the overall production of this office by, or set the goal to be 5% higher than last year?
Sure. Yeah.
So let's.
That would be a good, for an established practice.
Right. So let's click on add 5%. So I'm not sure if you notice, it just went up slightly by 5%.
Okay.
Okay. Since we adjusted that, I will actually, instead of adjusting individual ones, I'm just going to go up here and click on KPIs, and I'll say increase all of these ones by 5%, because if your production goes up, so should be adjusted production and your collections.
Got it.
So I'm going to hit the 5% up here. Perfect. And we will hit save.
Okay. Let's look at the new patients, for example. Let's say the goal for this office is they want to get 50 new patients a month.
Okay. So right now we have copied it from last year, and we have said it was, compared to last year, we said the same, but we can go here and say 50 for each month.
Okay.
So set. Okay.
Got it.
There we go. So we got set as 50 for each month and hit save.
That's so easy to do. That is great.
So here we are, target as of today, because what it's saying is if you're going to see 50, we want to see a certain number on certain days. And you should have seen 18 new patients by now, but you haven't. So you're running a little bit behind.
Got it.
Okay. So the colors are supposed to help you to say, are you on track? Are you behind? Or what's going on? Okay.
That's perfect. So with this, my suggestion is if you haven't already watched how to make a custom dashboard, that you go back and watch the videos about how to make a custom dashboard. Because when you first log into Practice by Numbers, it's quite overwhelming. Then figure out what you want to track and what you want to start tracking and improving upon. We just did videos on hygiene and pre-appointment percentage and perio percentage. So now on the statistics in the areas that you want to improve, you can go in and set a goal, either across the board just to match last year to make sure you're at least doing as well as last year, or the areas that you're looking to improve, like maybe you want to do some front office rocks training on verbal skills about getting patients to a point, and then track how your team's doing with that. So really take a few minutes to decide what's your focus. In my office, I'm picking a couple statistics a month, a couple areas a month. We're training on it, and then we're tracking it. And that's the best way to make this software work for you, because there's no point of knowing the numbers and having a goal if you don't have a way to achieve it. So from Front Office Rocks, make sure that you're picking what you want to work on, and then you're getting the training accordingly. Rohit, do you have anything else to add about setting goals?
No, just make sure when you do set goals, they make sense, because just setting goals and it lighting up red, green, blue, have to test all your goals. Make sure your goals follow the SMART. They're specific, they're measurable, they are
attainable.
Yep. R is they are
realistic,
and
timely.
And yes, that's what this system was going to help you create, so that you can create those SMART goals.
And then make sure you communicate that with your team, because if you set a goal and your team doesn't realize that there's a goal they're trying to achieve, they're not going to work to try to achieve it. So thank you for joining us today at Learning How to Set Goals and Practice by Numbers. Rohit is available to you and his team if you have any questions with this, and if you need any training, please reach out to Front Office Rocks. Thanks for joining us today.
Thanks, everyone. Thanks, Laura.
Thank you.